Our technology-driven world is dramatically changing how we consume information. From healthcare executives to department managers and clinicians, they all receive many requests for reports. But this process ties up many highly trained analysts with the manual work of gathering and compiling data using paper-based data. Such tools are only capable of producing a static report, which has limited use as an improvement tool. This is because static reports lack the interactivity and visual display capabilities needed to help those who requested the report make sense of the numbers presented. Why is data so important within the healthcare system?
The project is about collecting and using real-time data in countries in the health sector, and in particular it's health facilities and health districts having access to data in real time so that they can look at that data, analyze and figure out how to solve problems that are happening in the community. And it's really important because instead of having to wait a long time to get information collected on paper or information collected and sent to the capital, people can have that information in real time in their communities, and then they can act on that data.
You know, some scholars, they say, if you cannot measure it, you cannot manage it. Information at your fingertips, power in your hands. I know it takes a lot, it takes efforts to come up with such information for policy decision making. So as a HMIS unit and the Ministry of Health, we were tasked to ensure that data is always available for planning. Not just data, but quality data.
Mangayane Government Hospital was one of the health facilities visited as part of the field visits by participants from the 4 countries under UNICEF's institutional support, with a special focus on real-time monitoring using routine systems data and citizen feedback. The public health unit at Mangayane is in the process of transitioning from the old health management information system to an electronic system. Information is still paper-based initially, and data is then captured at a later stage by computers, where the information is then shared at national level. The team was taken on a conducted tour by senior health officers. Here are some of the highlights.
Here at PHU, it's whereby we are able to see mothers, babies, and a family at large. We make sure that when the parents came, both of them, we allow them to come together so that they can take care of the child, even to see what's going on inside. First of all, we make sure that we have our serial number. The serial number of that month, that was April. This is our serial number. We have the date whereby the child comes, initial visit of that child. Then we give the child a child welfare card number. Then we have the name of the child and the surname of the child. We also have a date of birth of the child, even the sex. If the child has come with the ID number, we enter it. But if the child doesn't have it, we emphasize that they take as a birth certificate so that we enter it. Yeah.
Do the children, when they are registered here, get a PIN number here, or they have to wait for some time to get it?
We have decentralized it. When the mother and the child comes out from delivery, they register at the maternity. Then when they come for 7 days, it's whereby they go via the death office to collect the child's ID number and the birth certificate also, so that we can enter it in the register here at PHU.
The new health information system will bring many positive spin-offs. It is hoped that U-Report will be used to help track and inform clients of their next appointment date via text messages, alerts and reminders.
In this regard, I must say that this is where we are looking at using your report to be sending constant reminders and alerts and also information on parents to come and immunize their children or for any other appointment or service. We intend using your report, integrating your report within this department.
When clients are found to be HIV positive, they are then initiated immediately. They are also entered into the appointment register. This helps control the number of clients seen per day. Clients under 5 years do not visit the pharmacy as treatment is prescribed and conveniently provided within one department.
There is no need for our clients to go to the pharmacy like the other clients in the facility. So we prescribe the treatment and we give them here and then they go home.
Next, we visited the data room.
This is our data room. It's whereby the patient's information is kept. All the clients that are seen and also all the clients who are on ART, their information is kept here.
All clients who are on ART, they are captured here. So we can get any analysis of all those who are on ART in terms of ages, in terms of gender or sex, I mean, and when are they supposed to be coming for their next refills and everything. The initiative which we have started, I think is going to assist us to achieve so many things like doing this periodical analysis of some of the things which we would like to see, because the data has not been that much fully utilized, you see. It was just only for national level use. It's through this initiative that now we are enforcing to come down to the facilities to assist them, use their data. And then in that way, I think the gaps which we're seeing now, they're going to be very much minimized.
For the information and the data that you're talking about, it's for pregnant women who do come to the facility, right? Don't you have those that give birth at home who do not, maybe they're religious objectors and they're not allowed to come to the facility? What is the strategy that you use for those people that don't come to the facility?
Now we have our community mentors. They usually encourage the mothers to call 977 most of the time. When the mother is on labor, let's say she's on labor or she's due to come this side, it's whereby we use our 977. The 977 ambulances usually they go and collect that woman in case she doesn't have money. She can go and collect her so that she can be done ANC or else she can be done delivery here safely.
This is a PMTCT room. We do counseling, we do HIV testing counseling, and also start ART to those that test positive. We do antenatal health care to first ANC attendants. If I say ANC attendance, ANC, it's okay, you understand, okay. So ANC start here before we give them a card, we test them after counseling. We've got this document that helps us to forecast the fracture to cancel according to the need of the patient. These are the topics that are covered. So it depends on the person that is coming that we are able to decide which topic to discuss with that patient. And if that patient is positive, we prepare her for lifelong ART, because some come not prepared. When we started the program of PMTCT, it was a bit difficult. But now, I think we have educated them in the communities. They are able to, when they test positive, they are very prepared to start ART the very same day. That has seen our children being born without HIV. We are seeing the numbers lowering. I think, I don't know in the total report of our PMTCT, but the numbers have gone. We haven't recorded a positive infant since we started, maybe one or two. especially those that do not adhere to the ART. Otherwise, those they are taking, we don't get any infections to the infants. We use the registers, and then we capture the register every month, end of month, and this is what we do. We capture it. That tells us how many were tested, how old, males or females, why they came for the test. But this is just a piece of paper. We would like to see it captured in a computer, you see what I mean? So that in last year I would just show you that since January to December, we have tested so much males and what was the reactive, whether positive or negative. Of course, we do have it here, but it's not as clear as it would be if you want to beam it for somebody as a visitor.
It will be until when we roll the CMIS that's when they will do away with this. Because now they'll be logging into the system. Whenever they see a client, they will be putting that client into the system. For now, they will continue with this, but I think a computer would assist just maybe for their own reporting, that when he prepares this in summary sheet to send, he won't be filling it in the papers like she's filling, but he will just fill into the computer and then probably send by email. Because for now, even if you want to send by email, he has to scan this and email it, you see. So I think a computer will be handy in that regard for now.
With this issue of dashboards that are coming now, we think it's going to help us to analyze our data that we usually collect on these registers, and it's going to help us see how we are performing.
The delegates then met in the boardroom where a presentation on the dashboards was made. Paper-based data takes a long time to be updated and thus can cause distorted reports, as we heard from a local health worker.
For instance, I went to the last NASA at Orion, so they mentioned that about 50% of the clients were introduced to Atribla. It seems they are lost. So I got that information there when I was on that meeting. So I said, this is, that data is not mine. I ended up leaving that meeting. I'm sorry to say that now my manager there is hearing that, but I was angry. So what I'm trying to say, with this type of data we get from this dashboard, it can help a lot because I'll identify that gap early.
And with the integration of your report, it's going to be easy after immediately noticing the gaps that you'll be having with your clients. It's going to be very easy to quickly get hold of them, or rather educate them on the importance of coming back for refills or anything that you want to be addressing at that particular moment to ensure that they promptly come back to the facility. It's going to be easier that way, instead of waiting for a whole month and losing those clients and probably even having most of them default or losing them forever within the system.
Healthcare dashboards are critical for users who need quick and insightful answers to their questions in an easy-to-understand visual format.
There is a number of indicators under child welfare that have been developed, and the plan is to move forward in adding more with consultations from those that are working under those departments. We've also done HTC, we've also done inpatient, looking at general inpatient and also deliveries. So there's plans to escalate that to the next level.
You may want to have a general picture of what's going on, like in the hospital. So like the hospital administrator would look and see on one dashboard how all the departments are doing, rather than going to so many dashboards.
He said the senior guy here, he said the information goes to the regional and then it comes up down here. What is the process or the journey of the data from here for you in order for you to interpret it?
So all along they capture it on paper, but when you get to region, now we're transitioning to electronic. Once they capture it into the system, then that data also can reflect at national level for public consumption. So only then, when now the data has been captured in the system and it's now available for public consumption, do they have the opportunity to view their own data. But now bringing in a dashboard, it means that as they're capturing the data, now automatically they can already review what's happening in their facility. So it's a process of creating data usage to be back into your hands as quick as possible, because we do admit that the current system is not good for facilities to use their own data. Like he explained where he went to NASA. NASA is a national event where facilities are awarded for their performance when it comes to the different things that they captured. So for you to get there and to be told that your facility has not been performing well in this indicator, it's really frustrating, especially if you know you've been capturing the data very well. So I don't blame him for walking out, but now he won't do that because he can just look at his own data and say, hey, regional level, I saw the data that you captured. That is totally wrong. Please rectify it this way.
I think there's need for the HMIS or the data people to sit down with the users and see what their needs are and plan accordingly. So you guys need to sit together and make sure that whatever they need is in place. The trainings, the materials, the computers, everything that they need is in place for the system to work. So you need to have that meeting and sit down.
We shall do as they request. Actually, it's something we realized when we were doing the deployment of the dashboard, that we need to strengthen the issue of basic training in terms of the usage of the dashboards.
The King Sopuza II Clinic provided participants with an opportunity to view the newly established Client Management Information System, CMIS, which is a real-time information system established to generate reliable data in support of timely decision-making and improved service delivery.
This program or the system is quite very new. It's in infancy stage, like she has alluded to the fact that we are the pilot, as she has mentioned. But it has come at the right time for KS2. You can look around, you will see how many registers we're using. We will put them from this end to this end and start perusing to see if the client is able, we are able to fit each space for immunization, for all the package that we give per child, even for mothers. So now, this one we have labeled it as a lifesaver. To us, it is a lifesaver for KS2. It has reduced the lot of registers. It can give us a lot of information. We can get reports daily. We can also get cohorts from the same system. We can even analyze our data ourselves and see how we are performing. So later you will see the dashboards.
The focus of the field visit here was on data use and response using analyzed data presented in the form of dashboards, several of which were developed through the UNICEF initiative, so real-time data is available in areas beyond HIV.
It means we'll be able to pick up whether the problem with the inefficacy of the medication is due to the client weakness side or due to the weakness from our side, because there are so many contributing factors. So I think really this system is going to come up with advantages or benefits from both the clients and of course from the Ministry of Health side.
I'm trying to understand the process. When the clients come in here, they get registered and then they get entered, and then what comes out? I'm trying to understand that process, and in terms of how long it takes to do that. So that's one question.
The barcode is needed to say that the client has been entered in the system. So for next review, you just they just scan, and then it will show the uniqueness of each client.
The computerized system, this system is only for primary health care, or dental, dermatology, antenatal, are all connected to the system?
It's for everything.
It's everything, yes.
All our tests that are done from the virus departments they can be sent via the system so that the one who is the site can just receive the request from the virus departments that a CD4 has been recorded for this number of a patient. When the patient comes, that a particular sample is taken, and the one who's here in the laboratory will also feed the results so that the other person on the other side can just receive the result from the system without moving up and down. So that is how we basically use our system. The laboratory is linked. It will also tell who took that sample, the site, and will also reflect as well who has requested that sample, because as they said, we are given certain rights of administering in the system.
The component of data quality and usage, it has been lagging behind. So that's why we're saying we are so grateful really from UNICEF for such support, because people, they are more interested on the data. No matter how brilliant the system can be, but they need the data. Not just data, but quality data for policy decision making.
For somebody working here, you had a manual system before.
Yes.
So, and in the manual system you had to write things down and you had to go through paper records.
Yes.
Now you've got this.
Yes.
Is this faster overall? Do you spend more time on record keeping or less time on record keeping now that you have this system?
We spend less because we don't have to page back. For instance, with a register, I'm sure you enter that patient once. When he comes back on another day, I have to page back the register and find that person. Yet now, with her ID, I can just go straight to that patient, and I can also see what has been administered to that patient.
So part of the advantage is you can see everything, and part is that it's faster. So
Yes.
it's a bit. Do you have any guess about, I mean, not precisely, but do you have a guess about how much time you save? Because it takes time to enter the data and everything, so it's not that it's free of time. But would you say that you're saving, let's say, 10% of your time on record keeping, or 50% of your time? You know, how much time are you saving on the record keeping? Just a little bit or a lot?
A lot. Maybe I can make an example with report writing. We used to write a report like over 2 days, trying to find the reports and trying someone to look through if you haven't missed people from the pages as you were writing that report. But now within 5 minutes, you get the full report, whether it's a month, it's a year, it's a day, it's according to your request from the system, and you are able to give others to analyze it together.
Now we have data, you are using the data. Have there been any implications or effects on actual service delivery? Are you beginning to see any impact? What has happened to service delivery, or any experiences with service delivery?
Actually, because with the registers, maybe I can make an example. It was, let me make an example with testing. You were finding that we were having so high numbers, because when you test somebody today, it doesn't really believe what you tested here. So it would come again. But with the system, you can tell what you have been recently tested, and you are eligible for a retest on such and such a day. Even with the services, even if the person is coming from where the CMIS, like Nhlangano, you can tell what you have recently been refilled with ARVs, or this baby has been recently immunized. And it's making it easier for patients because they don't have to have specific numbers for different facilities. We just move forward with one number, and the patient can access any service anyway as it's being rolled out in the different facilities.
And maybe to add on that, to say through the support from UNICEF, we were also able to procure a server. That server will be so ready for reports, sharing of the data. So we've already configured the server. We are going to use a SharePoint. We are trying to come up with a mini national information repository where the different management from different facilities will do data mining and also do data sharing with other facilities and also reach at regional level. I know it's at its infant stage, but we are somewhere because we've already configured. We've migrated some of the data into that server that will only be used for the reporting.
I think the trickle down of the efficiency that the system is affording the staff here is that now we are able to communicate directly with the clients themselves. So on their way out after receiving the services, through U-Report, because that's our citizen engagement platform, they answer a series of questions which include things like waiting time, things like cleanliness of the facility, availability of drugs, and so on. And from what we have already gathered, a majority of the respondents that have taken this service so far are saying that the amount of time that they're spending at the service points is between 30 minutes to 1 hour, which I think is incredible. It's a pity that we do not have a baseline to fall back on to just be able to make that comparison. But I think going forward, as more and more people take these surveys, then we're able to trace and just explain the trend going forward. But also the accrued advantage of this is that we're able to do things like health education, for example, for the patients that are receiving medical care here. But also for those that are specifically here for refills, we are able to send messages. This is something that is still in the pipeline, but one of the things that we're thinking about is sending them periodic messages reminding them to come over and receive their refills. So these are just some of the accrued advantages that we're already beginning to see.
Okay, on the dashboard here we are. These are the appointments. It gives us a view of what is happening in this department actually. So these are the clients which we are expecting to come in the facility. So if you click the dashboards, then it shows you pre-art clients that have to come on that day and HTC clients. And also, if you move on, actually it shows you who is supposed to come and who you are expecting to come. And if they didn't come, then it tells you that you have to make a follow-up on this client. What is happening? Did you miss your appointment? Why are you not coming today? So that we can see how to intervene in that aspect.
Healthcare dashboards are critical for users who need quick and insightful answers to their questions in an easy-to-understand visual format. It is much easier for health workers to see if the metrics are still in their desired range rather than trying to digest a monthly line item report of patient data. Because of the near real-time data dashboards display, workers can visualize where they are, where they are going, and how fast they are headed there. This enables quick course correction if needed. A healthcare dashboard helps spread a much-needed single source of truth across a health system. When everyone in the health facility has access to a constant, reliable source of truth, then everyone can speak the same language, spread a system-wide standard of care, and work together to implement improvement initiatives.
Data is only useful if it's collected and used at the right time. Quality of data is measured through a number of factors, and one of the factors is the timeliness of data. Data should be collected and be used at the right time so that it can make an impact in the population for which the program is serving. And therefore, there is need for real-time data, meaning that the distance between collection and use of data should be as short as possible for that data to be meaningful and useful to decision makers and ultimately to the people who control programs that are supposed to make a difference in the community.
Well, I think now we've had kind of a first initial phase in the project where people are kind of planning and figuring out what to do. Now we're in the really period of fast kind of accelerated implementation, when really the countries put in place these plans and then look to how we can scale them up in the countries. What's exciting for me about the project is we have these 4 different approaches in the 4 different countries that are learning from each other, and in this way we can learn a lot about how to do this same kind of work in other countries in the region or even more broadly in the world. So it's helping us generate a lot of knowledge about how to do this real-time monitoring, and that can contribute to both these 4 countries and to other countries as well.